First and foremost, we wanted to offer the chronic care management services to help the patients of our community. Chronic conditions such as diabetes and hypertension are very prevalent in this area. Access to patient education resources, however, is very limited.
And another reason for providing chronic care is we wanted to try to help educate patients more about their chronic conditions and to be a go-between with their physicians in between their doctor's appointments, which normally occurs about every 3 months.
Right, and another reason we wanted to offer the service is from a revenue standpoint. The days of filling prescriptions in a small hometown pharmacy and surviving, I think, are gone. I think, as an independent pharmacy, we have to adapt to the current market and innovate to survive. So, any service that we can offer to patients that is, number one, patient-focused, patient-centric, however, also adds a source of revenue to our business is more than welcome. So the typical patient is enrolled and consented in the chronic care management program by their provider. We then call that patient to schedule their first meeting with our pharmacist here in our pharmacy.
So when the patients come in for their first meeting, they bring all their medications with them. We sit down, we go through their medications, make sure they understand what they're taking, why they're taking it, and how they're taking it. And then also we talk about, proper storage and disposal of their medication. And then when they leave that meeting, we have a list of all their meds, and we also schedule, the next follow-up appointment with them.
And you'd be surprised at that list of all the medications that their patients are on. A lot of times their provider has no idea that they're on certain medications. We have some patients say that they were watching Dr. Oz and he recommended a medication, or their neighbor told them to take a certain medication. And these are things that are important that the provider knows that the patients are taking. So that's the first thing we do is we contact the provider and we make sure their medication review is updated. After that, follow-up appointments after the first in-person appointment are typically every 30 days. Many patients choose to have this over the phone because of transportation issues. However, I'd say at least half of our patients actually prefer to come back in the pharmacy every 30 days and have that human contact.
I think one patient that comes to mind would be our patient from yesterday. Patient was diabetic, also has hypertension, and when he came in, he had his insulin with him. All of his pens were at room temperature, so we obviously educated, about leaving one pen at room temperature and storing the rest in the refrigerator. I think another thing is I found out that his pen needles that he used to inject the insulin, he was reusing those multiple times. So I, educated him about a clean needle each time when he did his injection. I also found out when he's testing his blood sugar, he's using the same Lancet multiple times to prick his finger.
Yeah, and the patient actually experienced vision loss because of his diabetes, and he couldn't read on the insulin box where it said refrigerate. And this whole time he's been on insulin, it hasn't been refrigerated. Which I'm sure led to an elevated A1C and blood sugar and everything else. So another thing we did, the patient we found had never tracked his blood sugar levels. So we printed a log and delivered it to his house, and every month that patient fills out his log and he comes back in, and so far we've definitely seen some improvement, and he enjoys doing that too. Now he understands, how to help his condition. The advice I would give to other practices regarding chronic care management is go ask your local providers, particularly primary care providers, if they are doing the service. I've talked to many independent pharmacists that say the providers are already doing it, and they're not. They can't be. If you look at the statistics, chronic care management is severely underutilized. Medicare, even lessen some of the requirements to participate and bill for chronic care management this year because so few people are actually using it. They see the value in it. We all see the value in it. Patient education is needed tremendously right now. So go ask your providers. It's very good for the patients. It's a great asset to have, both in terms of patient care and also as a business for reimbursement on both sides. You know, the margins in pharmacy, we all know, are smaller than they've ever been. But the margins in primary care are doing the same thing. Everybody's seeing it. So a service like this has been welcomed by both sides.
So you've just heard from the clinicians and all involved in the chronic care program. Everyone should have access to this program. Wouldn't you like to try to get a similar program in your community? This is an example of an idea that works.